Hello, a very good afternoon to you all. Welcome to your Teledoctor Show. My name is Professor Wilbroad, and we are back again with a special program. And this has been very close to my heart, and we want to discuss something that you might be surprised. It's a problem, and we'll go into details about that. We are discussing surviving snake bites and what you need to know. Surviving snake bites and what you need to know. And I've got a special guest, but before I introduce him, I want us to go to the common segment where we talk about health and wealth. And today I want you to enjoy this segment, and if you've got any questions, please do reach out to us and Mafipe, and we should be able to help you. So because we believe at Teledoctor that if you are healthy, then you can create wealth, and that wealth should contribute to your health. And so this is a segment that we want to bring every week, not every day, every week at this particular hour. Enjoy the video. You and welcome to our Teledoctor Show. We are continuing with this segment of health and wealth. Your health and your wealth are connected. Somebody who is financially stressed, has got a loan and the bank is following them, they are being taken to court, they can't be in a stable health. So by managing your wealth indirectly or directly, you are also impacting your health. And my guest again is Mafipe Chunga. Welcome.
Thank you very much.
What can go wrong with investment?
A number of things can go wrong. Some investments are very difficult to evaluate in terms of, am I gaining anything or am I losing?
Yeah.
A typical challenging investment is a farm. A lot of people are working and they're also running a farm. So they're getting income from their employment and sending to the farm.
Yeah.
They may or may not get anything back from there. If they're not tracking that investment going into the farm and what's coming out of it, it's very easy to make indefinite investments that are then being written off, but you're not tracking it, so you don't get to see it.
And you're becoming poorer.
Yes. Poorer because you take on a wage bill, so you're sending out salaries every month, you're investing in equipment, you're building up capacity, buildings, etc., but it may not bring you any income back. Risky.
So a message for this, for everyone that listens to us today.
Today, please track your investments. If you're making an investment, have a separate bank account for it, have records for it so that you can track that investment to see if it's really an investment or a black hole.
I like the black hole. Thank you so much, Mr. Chu.
Most welcome.
All right, so if you got that, basically you need to look at your investment, and if you've got any concerns about your health, your wealth, your Teledoctor is just in the comfort of your home. Our Teledoctor app is also available to use. Please do download that. And Mafipe is also there to consult on the health and wealth on the Teledoctor app, so don't delay. So our topic for today is surviving snake bites and what you need to know. And you might ask, why are we bothering about this? So snake bites is a global problem, but what they are called neglected problems, which means it's a problem but it's not on the top priorities. And several people, actually about 2.7 million people die of snake bites worldwide, or get bitten, and then over 400 of those get permanently damaged, and also we have got people that die, almost 137,000 that die annually. And so the point is, what do we do when you get a bite? Or is this a problem in Zambia? There are so many questions we can ask, but I don't want to preempt this discussion because my guest in the studio today is Marcel. I don't want to pronounce your surname, but welcome.
Thank you very much.
Aksha. Yep. So Marcel, just talk a little bit about yourself before we delve into this important topic of snake bites.
All right, yeah. So my name is Marcel van Driel. I'm originally from the Netherlands, but I've lived here in Zambia since 2011. Married a Zambian. I'm here to stay.
Okay.
Yeah, and I work as a consultant, but part of the work that I do has everything to do with snakes and snakebite.
Excellent.
Yep.
All right, thank you so much. And we are happy that you created time to come and talk about this issue. And the first question I want to ask you, what should people know about snakebite? If somebody just came to you, just the first few things, what would you say? Just know maybe 3 things about snake bites.
A snakebite can be prevented by making the smart decisions, and actually preventing snakebite is a lot easier when you know how it works. Second is whenever there is a snakebite, do as little as possible about the bite site and rush to a hospital. Definitely don't resort to home remedies or traditional remedies. Go straight to a hospital. Those are the 2 most important things. And thirdly, if you have a mobile phone, call me to get me involved, because I provide advice in snakebite cases, both to the general public and to medical professionals.
Excellent. So, how common are these snake bites in Zambia?
Well, we don't have data, really good data that is comprehensive in Zambia. We have some data from the ministry, which is not complete, because people that don't reach a hospital on time or don't go to a hospital in the first place are simply not captured in that data. But if we look at data from around Africa, and if we extrapolate that to Zambia, it could be that we have in excess of 36,000 bites each year, out of which approximately 5,000 are potentially deadly bites. That these are bites from pufferers, cobras, and black mamba.
Okay, so we could have as many as 5,000 bites.
No, 36,000.
36,000 within Zambia.
Yes.
If everyone reported
on the rural population only.
Yes.
Yeah.
In fact, that's what I want to ask you. So, is there a particular population where this problem is prevalent?
Of course, as with most health issues, the most prevalent it's among the rural population of Zambia, the rural poor, because people that work in the field, small-scale farmers, their work brings them in close proximity to where the snakes are.
Yeah.
So the snake bite incidences are much more common there.
In the rural areas.
Yep.
Okay, do we have some in the town areas like Lusaka? Do snake bites occur here?
Yeah. So I get a lot of phone calls from people that have been bitten by snakes, or nurses, clinical officers, and quite a number also occur, for example, in and around Lusaka, not in the town center, but
just
in
around
Lusaka
in
West, in Guerrero area, we have snake bites features, Brazil area. Yeah, it's even in the peri-urban, snake bite can occur. Yeah.
I see. So, what are there conditions that make people much more prone to snake bites than other conditions? Maybe in the day, in the night, in the morning? Is there some time when, even the seasons? Yeah,
of course. First of all, definitely the profession. If your profession brings you out in the rural area, in national parks, in areas where snakes are more prolific, you're more likely to encounter a snake and get bitten. But also we see an enormous uptake in the number of snakebite incidences in the rainy season. So when I get about maybe 2-3 snakebite calls in the colder, drier seasons, I might get more than that per day, like 5-6 different snakebite cases to deal with in a day in the rainy season, especially the first 2 months of the rainy season.
Why is that?
Well, then snakes are a lot more active. A lot of the snakes have just had young. It's also because, first of all, it's nice and humid, it's warmer, so for snakes it's much more easy.
When the rain is coming.
When the rain comes and just after the rain. It's also because then that's when their prey has reproduced, so there's a lot more prey, the youngs are about. And also this is the time when our farmers go to the field or come back to the field. So we have activities on the human side and more activities also on the snake side. And that leads to incidences.
Okay.
Yeah.
So, what about in the night? Is there anything about, because do snakes see in the night? How do you, because sometimes people are bitten, you don't even know that you have been bitten. You just feel like, was it a prick? What was that?
Yeah, well, so a lot of snake bites do take place after dark. Very often, we say the golden hour for snake bites. Is there such a thing?
Just mention the golden hour.
Yeah, between 5 o'clock in the afternoon and then like 10, 11 in the evening.
Okay.
That's when a lot of snake bite incidences occur. That's also because that's when people come back from their field. And that's when a lot of snakes have come out, because it becomes darker, so they feel safer to move around. Because snakes, snake is a very long, vulnerable tube with only weapons on one side.
Yeah.
So they're prone to be predated also by other animals, and they were getting killed by humans, of course.
I see.
Yeah.
Okay, so is there anything that would make the snake, which was not supposed to bite you? What would you do wrong? Maybe the snake was supposed just to go in as innocent, but something happens between you and the snake, and it results in, and if possibly you could have avoided, but you did something that provoked a snake.
Yes. So sadly enough, and a lot of people always contest this when I explain that, is that it's our actions that lead to snake bites.
Okay.
Snakes want to preserve their energy on killing and eating the prey that they can swallow. We're too big for them to swallow, so we're not prey for them. So the only reason why they bite us is because they feel the need to defend themselves. It can either be because we try to kill them or catch them without being properly trained to do so, or when we simply walk too close to them, they feel scared, because for them we are very big creatures. And when they feel scared, their only way to defend themselves is making warning sounds, spreading a hood like a cobra would do, and in the ultimate case, to bite us. So
there are steps before.
Yes, exactly. So if we heed their warning signs, for example, if you see a cobra rearing up, it's a sign, leave me alone, I don't want trouble. Because if they would be mean, like a lot of people believe, they would just sneak up on you and bite you. They wouldn't give you the warning signs.
So when they stand up, they expand like that, they are giving a warning sign.
That's a warning sign. Hissing and puffing is a warning sign. Some snake starts to move around, thrashing. It's a warning sign. There are a lot of things that snakes do.
So what should you do? What should you do?
Well, the moment you see a snake in the wild or in a field, you just back off and you walk around it. If it's on the path that you want to take, just walk around the snake and continue. The next day that snake might not be there anymore. And then you have avoided a conflict with that snake. It's literally that simple. Now, of course, if the snake is found in your house, it's a completely different matter.
Definitely. What about like when you are walking and you step on a snake, like you didn't see it?
Yeah, but then there's a chance that you get bitten. But then you still need to take into account that the more than 70 out of 100 and 203 recognized species in Zambia are harmless to human beings.
Can you just repeat slowly that one? How many snakes?
So there are 103 species of snakes in Zambia.
103 species,
yes,
okay.
Out of which 72 are harmless to human beings. That's the vast majority. That means these snakes are either non-venomous and are too small to really cause us much damage. The exception is the python, which is big and powerful. Or they are venomous, but their venom is not potent enough to kill you. Now, for people that don't believe that, I've been bitten by those snakes a lot of times and have absolutely no damage to any parts of my body.
Listen, because I think people, let me just remind our viewers, today we are discussing surviving snake bites with Marcel, and he is telling me that he's been bitten by snakes without dying. I think you might not agree with him, and I want you to call us actually and ask him some questions, what happened and what kind of snakes. And so this show is for you. We are going to open up lines very shortly. Let me ask him 2 or 3 questions, then we'll go for break, and I want to open up lines. So the number that you need to call us is on the screen, and this is your Teledoctor Show, and I'm Professor Mtale, as usual, talking to you in the Teledoctor so that you can know more and protect yourself from snake bites. Okay. All right. But so are there types of snakes that are dangerous? You already hinted to this, but can you say which ones are commonly dangerous in Zambia and which ones are harmless?
Well, there's no feature in snakes where we can say if a snake has that, then it's a dangerous snake.
No.
But any snake that looks short and very fat looking, it's always a dangerous snake because that is a puff adder or gaboon adder. They're potentially deadly snakes. So
short, anything short
and fat looking with patterns on the body. That's one. Second, if you see a snake that has lines along the body from the head to the tail, it's always a harmless snake. That's a snake that cannot harm you even if they bite you. But if it has bands around the body, around the body,
like there are squares going around,
like lines going around, like bands.
Yeah.
If that is the case, that snake can hurt you. It can't kill you, but it can give you a very painful bite.
Okay.
Also, if snakes are more than 1.50 meters long, and that's quite long actually, they should be considered as snakes that are dangerous as well. Other than that, it's very difficult to say, okay, these are the snakes that can harm you, unless you know the species. But it's actually quite simple. If you see one of these fat snakes, these short and fat looking snakes, these are dangerous. Then the black mamba is a highly venomous snake, which is dangerous and does bite people.
How does the black mamba, we didn't even come with pictures, we should have come with some of the pictures. Yes.
Next time we need to
okay, we do have a caller, so I have to, yes sir.
Yes.
Hi, good evening, welcome.
Hello.
Hi, good evening, welcome to our show. This is the Teledoctor Show. We're discussing snake bites. Do you want to ask us a question, sir?
Yes.
Please go on.
Sure. There's a program here, surviving snake bites.
Yes.
So I need to know something over a certain snake.
Go on.
A boom slang.
Yes.
Yeah, a boom slang. When I was watching on National Geographic, they said once you are bitten by that snake, you can't survive for more than 5 minutes. Within 2 minutes, a person will die. So, how would you help such an individual, in such situations where one is bitten by a boom slang, and within 2 minutes the person is supposed to be helped, or rather survive the bite? So how would you help such a person?
Thanks, Isaac. Marcel is going to answer that question.
Yes, so first of all, there's no snake in the world that will kill you within 2 minutes. That's simply not correct. So the information you got is not correct. A boom slang's venom affects our blood clotting mechanism. So when you normally get a wound, you start to bleed. And if that blood clotting is not working, you don't get a scab, your body doesn't heal itself, you endlessly bleed and then you bleed out, but you also bleed internally. That's what the venom of the boom slang does. However, that takes very long to first of all show symptoms, and second of all, it takes even much longer for you to die from the bite. It takes between 48 and 72 hours. So you have days to get to a hospital. Now, the challenge with the boom slung specifically is the antivenom we have in Zambia is applicable to a lot of different snakes, but the boom slung is not covered. So a bite from a boom slung is a life-threatening situation because we do not have the antivenom in Zambia. It is in South Africa though, and if you are affluent enough or if you have a good health insurance, you can quickly get that antivenom from South Africa to Zambia, and you can still survive.
And how long will that take?
Well, it depends on how good your insurance is.
Okay, let's speak about antivenom, because you have already jumped. What is antivenom?
Okay.
Now, because I think now we have gone to the solution, maybe the questions came too early.
No. I think the question was good, but it also shows that there are so many sources about snakes that are not correct.
Exactly. That's why we wanted us to discuss the truth.
Correct, yeah, because the fastest working venom is that of the black mamba, and even that won't kill you within 2 minutes.
Okay.
So, yeah, antivenom. So antivenom is an antidote against snakebite envenomation. And what is done is they have extracted the venom from a lot of different snake species, a lot of it, put that together, mix that, introduce that into a very highly diluted, they inject that into large horses. Then over time, those horses develop an hyperimmunity, so they are immune to all the snake venoms. Then you extract the blood plasma, you purify that, and that then becomes the antivenom. And that is highly effective in all the snake bites from mambas, cobras, pafara, and kabunara in Zambia. And these are the potentially deadly snakes that we have in Zambia that often bite people. The boom slung is not covered, but the good thing is we have no records of boom slung bites on human beings.
On human beings?
Yes. On dogs we have had, because what
in
happens...
Zambia?
Yes, because what happens is if a boom slung comes out of the tree and moves, because they live in trees, and moves over the floor, over the ground, because it has seen a frog that wants to eat or it wants to move to another tree, it might get attacked by a dog. And then it will defend itself by trying to bite that dog. Now, probably the snake is going to die because the dog is more powerful.
Yeah.
But if venom has been injected in the dog is going to die. But how many people are going to catch and wrestle with a boom slung?
No.
Nobody does that.
It's very quick as well, yeah.
Yes. Plus a boom slung is very reluctant to bite. As soon as we get too close to them, they quickly go up high in a tree where we can't reach them anymore.
Excellent. All right, so we are discussing snake bites and what you need to know. And thank you for that call that the boom slung, you don't have to die in 2 minutes, okay? It destroys your blood clotting mechanism and can take up to 72 hours. Let's go to specific snakes because I think this is becoming interesting. I want you just to highlight some of the common snakes that are in Zambia. You have already hinted to this, but let's go slowly because I'm even thinking that some of them, I need to know some of the Bemba name, but I can't remember all of them. But let's go. If you do, you should mention if you've got any language which is local. So which is the most dangerous snake and what kind of mechanism does it use to kill people?
Well, the most dangerous snake is the snake that just bit you, of course. But if you get bitten by a black mamba, that would be the most life-threatening bite, because in a very severe situation where you have tried to kill that snake and that snake is extremely defensive, if it then bites, a black mamba in one strike can bite you several times. So
How?
Well, it lunges forward and...
Does it jump up? Because it's short.
No, black mambas are very long snakes. They can grow up to about 4 meters long.
Okay.
These are huge snakes. And if they rear up and lunge at you... Like a cobra,
they can stand up?
Yes, a cobra would just strike like this. That is a very short distance. So if you, 2 meters away from a cobra, you can't be bitten. But a black mamba can lunge forward and they can do all these movements. And the thing is, when they strike and they inject venom, that venom, if the snake is highly agitated and it's a big snake and there's a lot of venom injected, it could cause life-threatening situations in as short as 20 to 30 minutes. And you could potentially be dead within an hour. Now, typically what I've seen from the snakebite cases I've been involved in is that it takes about 6-7 hours up to 24 hours before somebody dies. But it potentially is the venom that can kill you the quickest.
The black mamba.
That's the black mamba. Now the black mamba is not black. It's a very long grey, brown, greenish snake, sometimes olive colored. It's always very dull, and it's a very big snake. I mean, they're born at about 50-60 centimeters, and within a year they can already exceed 2 meters. So they're very large snakes, and they're quite shy. So when they see you moving in their direction, they're already gone before you even notice that they're there. So that's the black mamba. That is the snake that could kill you the quickest.
Yeah.
The thing is, they rarely bite people because they tend to avoid us and they don't usually come into homes that much. More dangerous then are the cobras. We have the black-necked spitting cobra and the Mozambique spitting cobra as the snakes that feature a lot in snake bites. And that's because they very often follow their prey very close to people's homes and also in homes. Even around the Lusaka area, we've removed a lot of black-necked spitting cobras and Mozambique spitting cobras from people's homes and people's yards. Now, these are very dangerous snakes, but they won't kill you within hours. It will take many hours to days before you get into a life-threatening situation. So that again justifies the statement that if you get bitten by a snake, make sure you get to a good hospital as fast as possible. Now then, the next very dangerous snake is the puff adder. It's not dangerous because it's aggressive or it's mean. It's because that snake is so camouflaged, but it's also slow. So when it feels threatened...
How does it look there?
It's a short and fat-looking snake with a V-shaped mark on it along its back. That's how you can recognize it. At a very diamond or a triangularly shaped head, a thin neck, and on a bulky body. It's a slow and sluggish snake. They strike really fast, one of the fastest strikers in the world. But they move very slowly. So they don't flee, they stay put and rely on their camouflage and hope that you just pass them by without seeing them. But if you get too close because they are so camouflaged, then they might strike you because then they become afraid. Now, they have a very potent venom, which also at least takes you a day or more before you would die from that. But it's a very painful bite, which causes a lot of pain and swelling. And then there's a snake which is very interesting. It won't kill you, but it's a snake that features the highest in all the snake bite cases that I've been involved in Zambia, and that is the burrowing asp.
Burrowing?
The burrowing asp. Another name, which people usually prefer more, is the stiletto snake. It's a very small black snake, up to maybe 60 centimeters long, but usually around 40, 50 centimeters. And it looks like a big worm. So people sometimes pick them up. They actually pick them up when they pick up some charcoal or
together with it,
anything like that. Yes. And those can give you a very painful bite, which is extremely painful, causes a lot of swelling. But it's a snake, if it's well managed, absolutely is not going to kill you, and you should be able to survive without much damage to your body.
Exactly. So let's just go. So thanks for giving those examples. But let's go through what happens to the body by different snakes. Like one snake bites you, what happens to you? Is it the nervous system? Is it the clotting? Is it your breathing? Could you just explain the different types of snakes and what they do to your body?
Okay. It's less important to see what kind of snake,
the type,
affects you how. What more important is the type of venom that's injected. So different snakes have different types of venom, and we can group them in three. The one is called cytotoxic, which as soon as it's injected, it starts to destroy cell tissue. And
at the local place where you have been bitten.
And that's almost extremely very painful. First a dull throbbing pain that becomes intense, then there will be swelling which slowly increases up the limb. The second one is the neurotoxic venom, which you see in certain cobra species and in the black mamba. And that is a venom that hinders the signaling from your brain to your muscles, your skeletal muscles.
It blocks it.
Yes, so it becomes more and more difficult to move, but also at some point breathing becomes difficult, so you slowly suffocate. And then the third group of venoms is the hemotoxic venom that causes problem with your blood clotting mechanism. So you start to bleed internally and externally. Now the first group, the cytotoxic venom, that we see in puff adders, gaboon adders, the stiletto snake, but also the two spitting cobras, which are the most common cobras in Zambia. And if we look at all the snakebite records I've been involved in, and I've been involved in more than 400 snakebite cases so far to advise, we've seen that 95% of all the bite cases are cytotoxic, meaning they immediately cause a lot of pain at the bite site and a lot of swelling. Now what can we now do when you get bitten? In such a case, it's very simple.
That's my next question. Yes, please move on. Yes.
If you get bitten on the hand or on the arm, you keep that hand or arm slightly elevated and very still while you rush to the hospital.
Why are you saying still?
Well, the more you move, the more your muscles contract, and that pushes against a system called the lymphatic system, which is a parallel system to your blood circulation, and that basically pushes the venom also up into
your body.
So if I get envenomated, for example, here in the arm, and I start to move around and running around in a panic, first of all, your heart rate goes up, that's not good, and second of all, the muscles are now moving, and that just pushes the venom up in your arm. So if you keep that arm very still, and you stay calm, that venom is going to spread very, very slowly. Now the second thing you need to do, if you have jewelry, imagine my hand is going to be swelling, and you keep your ring on. My hand, it will swell, my ring won't swell with it, so my ring is cutting off my finger. So all jewelry needs to be taken off
before it swells.
Yes, and we need to allow that swelling to just happen. Now then, Don't make any cuts. So don't suck the bites out because you can't suck the venom out. Don't put any charcoal. Don't put any black stone. Don't put any poultices, any mixtures. To put nothing at the bite side. Leave it alone.
Can you wash it?
There's no need to wash. Well, you can quickly rinse it with some water. If there's excess venom, you can. And if you see at the bite side there's something sharp sticking out, it might be that one of the fangs has broken off in your hand or in your foot or in your neck where you get bitten. Carefully take that out because there might still be some venom in which you don't want to get into your body.
Yes.
Other than that, leave it alone completely. Keep it slightly elevated. If it's on your foot, make sure that you're lying down and your foot is elevated and you're brought in a vehicle to a hospital.
Excellent. So all right. So this is an interesting topic. So the lines are open. You see the number on your screen. Please do call us. We are discussing surviving snake bites on the Teledoctor, and Marcel is my guest today, and we have really learned a lot. What not to do when you are bitten. Most people would say, okay, why don't you cut the place? Why don't you put charcoal? So all those things are discouraged. And I think you can ask, because I'm sure maybe your mom, your friend have told you something. We want to hear what it was that was taught to you. We'll take a short break to listen to some of the information we've got from the Teledoctor team. After that, you can call us and we'll move to the next segment with Marcel.
Ambuya, are you okay? Thankfully, with the Teledoctor app, you can get premium healthcare from the comfort of your home. With the Teledoctor app, all it takes is a click, and you could not only have a nurse or doctor come and see you, you can also receive specialized services such as nursing and physiotherapy.
You see, Teledoctor aims to make access to healthcare services cheaper, faster, and convenient.
Did you know that 46% of the deaths that we record in Zambia are as a result of inadequate access to healthcare services? Seeing that was a gap, Teledoctor was birthed because it was working in line with what the Ministry of Health wants, which is providing effective and quality healthcare as close to the family as possible. We want to bridge the gap by telling you to get your smartphone and just download the app. Once you download the app, you can actually book for an appointment with a doctor or any licensed medical personnel. Do you also need a refill with your prescription? Quite all right, we do that and deliver the drugs from the comfort of your own home at your doorstep. So you can download the app or visit our website for more information.
Do you experience unexplained symptoms like chest pain, shortness of breath, dizziness, or heart palpitations? If so, a Holter monitor test might be right for you. What is a Holter monitor? A Holter monitor is a small, portable device that records your heart's electrical activity over a 24-hour period or more. It's like a mini EKG you wear all day. Who needs a heart monitor? Well, it's often recommended for individuals with known heart conditions. A Holter monitor can also be used for general heart health checkups, especially for athletes or those with concerns about their heart rhythm. How does it work? The Holter monitor consists of a small recording device and adhesive electrodes placed on your chest. It continuously records your heart's electrical activity, allowing your doctor to identify any irregularities. With the ECG 247 app, you can monitor your heart rate and rhythm in real time as you perform your daily activities like showering or exercising. Your doctor can also remotely access your heart data to provide expert analysis. For more information, contact us on 0979-904046 and email us at info@teledoctorzambia.com or search for our website at teledoctorzambia.com.
All right, welcome back. We are discussing snake bite. My name is Professor Mtale, and also on the show we are got Marcel, who is an expert in this area of snake bites. He's worked in Zambia for over 10 years and he's given us good information. And if you've missed some of this, the material will be also available on the Diamond and Teledoctor Facebook page in case you missed the first segments where we defined what issues are, why we are discussing this matter. And now I wanted to move to something that people usually do, Marcel, where they put a tourniquet or some kind of thing to block blood or the venom to go up the hand or the leg. What is your view about that?
Yeah, so tourniquet should be avoided in snakebite, except for in one case. I'm going to present it in a moment. So
yes,
if we know that 95% of all the snakebite cases are cytotoxic, where you get local problems, we do not want to keep that venom in one small place, because then the damage will be irreparable. Your body will never be able to repair it. It's that bad. Sometimes within an hour you can already see the tendons and the bones underneath the skin because of the damage.
Yeah.
So what we want to have happen is that the normal circulation of the body still can take place as much as possible, and the venom slowly to spread. That means that the effect of the venom is going to be diluted over more tissue, and that means you have a bigger wound surface, but the wound will be less intense, and that will heal much better. We've seen that if somebody puts a tourniquet and restricts the blood circulation, the damage locally is so bad that sometimes that even leads to situations where you have necrosis, or in severe cases where amputation is needed, when people lose their hand or their foot. And I have many of these photos, which maybe I should bring next time. So basically, tourniquet should never be applied.
We have got a caller from Solwes. I'll stop you there. Joseph, good evening.
Evening, thank you, Doc.
Welcome to our Teledoctor Show. You've got some questions for us this evening?
Yes, please.
Please go on, please, and ask Marcel some questions.
Yes, I want to find out when do we give the antivenom? Is it each and every snake that bites you?
Excellent question, Joseph. Marcel is here to help us. Thank you so much for calling, and have a good time in Solwes.
Very good. Yeah, it's a good question, because people always think, I'm bitten by a snake, I need to go and look for antivenom. Now, that looking for antivenom is an action which raises your heart rate. You shouldn't want to do that. It is up to the treating doctor to determine whether antivenom is needed or not. First of all, it depends on what kind of venom was injected by what kind of snake, and that we can identify from the signs and symptoms of the patient. Now, for the different venom types I presented earlier, the cytotoxic, neurotoxic, and hemotoxic venom, there are different indicators which will inform the doctor on whether antivenom is necessary or not. Now, in neurotoxic envenomation, almost always we do need the antivenom.
Yes, so when a cobra bites you, or...
Well, even a non-spitting cobra bites you. So the spitting cobras have cytotoxic venom, that's the first group. The non-spitting cobras, and we talk about some of the cobras you can find in the southern and the western province, mostly, and also in the northern part of the country where we have the forest cobra. They have neurotoxic venom which can kill you in, let's say, 5, 6, 7 hours, and that is very difficult to survive that without antivenom if it's a serious bite. Yeah. And then, of course, there's also in that group is also the black mamba. Now, if those bites are confirmed as neurotoxic envenomation, almost always we need antivenom. Now, the hemotoxic snake bites from the boomslang and the twig snake species, we do not have antivenom, and these bites are negligible in the number of bites we would have. We have no recorded cases. Then we are left with the 95% of the bites that are cytotoxic in nature. Now, there we need to see how severe the bite is to determine do we or do we not need antivenom. And the indication for doctors that are listening is very simple. If the venom progression, the progression of the swelling, the rate at which the swelling increases on the limb that is bitten, if that is faster than, let's say, 10 to 12 centimeters in an hour, that's a good indication that you would need to administer antivenom, because that is a very severe bite. However, if you see that after 2 or 3 hours the venom still hasn't reached the wrist or the ankle, then you know this is not going to be a serious bite where we need antivenom. We can treat very conservatively. So there are, for each of these groups, there are indications, benchmarks to say, okay, this is when we do or do not need antivenom. But this is captured in the national guidelines for snakebite treatment, which the ministry has launched last year.
Exactly. I will come back to that actually shortly. Yes. But you mentioned something that is interesting, that the snake bite might be serious or not serious, but is it not any bite by snake is serious? Like, how would you distinguish it? Is like a bit of bite? Because some people have run that, no, it wasn't a serious bite. This is a serious bite. How do you distinguish those?
Well, it's very difficult to distinguish those, because even if you have a snake bite from, for example, a night adder, which is very painful and leads to swelling, it's the same kind of venom as a puff adder, but it's much less potent. But initially, in the first hour or so, the symptoms and signs are exactly the same.
Yeah.
But at some point, it starts to develop differently. You'll see that at some point that swelling is slowly starting to slow down. It's not as severe. Plus, with a puff adder bite, you'll see that there's a lot of other things going to happen as well. So that's why monitoring and observing the patient continuously is very important to understand what exactly is happening to the body and do we need to intervene. But for example, one of the snakes that have potentially deadly bites, deadly venom that bite a lot of people is that puff adder.
Yeah.
Now, we've had cases, for example, a worker from a reptile park was bitten on the hand by a young puff adder, but it was still a puff adder of a size that could potentially kill a human being. They immediately called me. They did all the first aid well. They went to the local hospital here in Lusaka. They got very conservative treatment. The only thing that he had was pain medication, rehydration via drip line with a saline solution, and rest. And after a couple of days, he was back at work. At the same time, if you get a full-on bite from a snake which you have been taunting, that same puff adder, and it bites and injects a lot of venom, you could be in a serious amount of trouble, because at some point that bite can be so severe that the cell tissue damage.
So the amount of poison is more.
Yes, first of all, a bigger snake, a more adult snake has more venom than a smaller snake, but also if you have provoked that snake, it will inject
angry.
more venom. Yes, because venomous snakes can give a bite where they only give a little bit of venom or even no venom. We call that a dry bite.
Okay, there are some we are bitten but not bitten.
Yes, so for example, a very interesting snake there is the forest cobra, which has a very potent neurotoxic and cytotoxic mix in its venom. It's known that sometimes that snake gives a bite without even opening its mouth. So basically it gives a headbutt. It's just a warning. It doesn't want to waste its venom.
Yeah, to use it for other things.
But if you hit that snake once or twice and then gets a chance to bite you, it will inject a lot of venom, and that is a life-threatening situation.
So are you saying that we should not be killing snakes?
Of course we should not be killing snakes. Why should we kill all the snakes?
People, did you hear what Marcel said, that we should not be killing snakes? Okay, I come back to you. Why? What should we do? Because snakes are in the house. Snakes are biting our. What do we do with the snakes if you don't want us to kill them?
Okay, so we have a list of snake removers on the various Facebook pages that we use, but also on our website. I would always advise people download that list. It's either in a photo form, JPEG, or in the PDF form, and keep it in your phone, or at least check who is the person closest to me.
Yeah.
Save that number in your phone in case there is a snake emergency. And then you can call them to remove them. But the sad thing is, we're not even covering a percentage of the service area of Zambia.
No.
So in a lot of cases, people have no access to somebody that can help with removal of a snake. Now, a snake in the house is a very dangerous situation, and the snake should not be there. So if you're confident that you can either sweep that snake out with a broom or kill that snake without you being in danger, you need to be able to do that.
I'll stop you there.
Yeah.
We've got a caller from Chilaumba. Good evening, good afternoon. How are you? Hello.
Hello.
Hello, good afternoon. How are you, sir?
Hello. Hello.
How are you, Godfrey?
How are you?
Very well. How are you?
Yes, I'm Godfrey calling from Chilaumba.
Please go ahead and ask us your question, Godfrey. Yes.
I just want to ask the doctor if he mentioned something saying after being bitten by a snake, you don't have to apply charcoal. There are some people selling charcoal helps. According to them,
we lost the caller, but I think you got the point.
Yes. So the question, does charcoal work or not? Now, there are two ways in which you can apply charcoal. The one is on the bite area. Now, the venom, as soon as it's injected, it's spreading out in your cell, in between all your cells in your cell tissue, the fluids that are there. Plus, slowly it gets absorbed into the lymphatic system, which transports it away from the bite area. If you put charcoal on the bite area, it will never get in touch with the venom. Now, even anti-venom, for it to neutralize the venom, it needs to be in contact with each other. So charcoal on the bite area is going to do absolutely nothing. It's just going to be lying there, and it just basically makes your hand dirty.
And the poison has gone.
And the venom, meanwhile, is already transported, or it's already doing its work, and it's not getting in touch, so it can't neutralize. Now, the other way, what people think works is you need to have activated charcoal. Charcoal in powder form,
you can
drink. Now, if you drink it, it works against poison. That's why the difference between venom and poison is important. If you're poisoned, for example, you've eaten something bad or drank something bad, that is positively charged, whereas the charcoal is negatively charged. Positive and negative bind to each other. And then your body recognizes charcoal as, we can't eat that. There's no nutrient there for us. So either it comes out the natural way or you throw up. And with throwing up or with the natural way, some of the poison goes out as well. But that's all via your digestive system. The venom is traveling here.
It's not in the tummy.
So they never get in touch with each other. How is that ever going to work?
I'll stop you there, Marcel, because we're running out of time. So what is your message to the Zambian people who are listening today about snake? Just one last message.
So one very important message I would give is we can prevent snake bite by protecting our feet and our hands. Don't put your hand or feet where you can't see what is there. Don't walk around in the dark without a torch. Don't walk through bushes, because 99% of all the snake bites take place on the feet, ankles and lower legs, and the hands and forearms. So if we protect those parts of our body, don't put your hand in a mouse hole to get the mouse in the Eastern Province. That's putting yourself in harm's way. If you avoid that and you just constantly, when you're in the bush and there's snakes around, be alert that there might be a snake. That's how you can avoid snakebite. And in the end, in any medical situation, avoiding is always better than having to cure it.
Excellent. Myself, to stop you there, thank you so much for coming.
My pleasure. Thank you.
For the callers, thank you so much for calling. So this is Professor Mtale signing off. Bye for now.